Now we'll turn to Dr. Noam Yehudai, Director of Baruch Padem Medical Center, as it's known here, Poriya, to discuss how advancements in regional healthcare are ensuring those communities thrive with better access to medical care. Dr. Yehudai, thank you so much for joining us today.
Hi.
What types of challenges have you encountered since the war broke out when it comes to working in the medical field up north?
Well, the last year have brought a few challenges to those who are responsible for delivering medical care in the north of Israel. At the beginning, there was a challenge of taking care of tens of thousands of citizens who were evacuated from their homes. Many of them actually arrived to hotels surrounding Tzafon Medical Center, and we were obligated to deliver medical care for them since they were here several months, even though some of them are still here, relying on us as their regional medical center. Since September, where the northern frontier became active, we actually were facing a different challenge, and this is the challenge of continuing delivering medical care under fire, which is a situation which we are not used to. And for the first time in the history of our medical center, we had to go underground, and many of our departments were located underground for several weeks. We had the opportunity to continue with the regular care, since we, in regular times, have sheltered area in our hospital with significant services like emergency room, intensive care unit, dialysis unit, and others who are sheltered in regular times. So we were able to continue with the regular care. But this is a technical challenge. I think that the main challenge was actually with the staff. Many of them arrived from areas or under direct fire, yet had to continue and had the obligation and commitment to continue to arrive to the hospital, even under fire, even if they had to park their car to the side of the road when the alarm, when they heard the alarm, and continue to the hospital with the mission of, as I said, to deliver continued medical care to the northern region.
It's not something that most people can imagine handling. It's a complete change of general routine. Tell me, what kinds of solutions has the hospital implemented to respond to the war, and also to enter the stage of rehabilitation that the North is slowly moving into?
Well, I strongly believe that the rehabilitation of the North has to do a lot with healthcare. And a lot of the sense of security that the civilians of the northern Israel feel and need to feel in order to come back depends on the stability and the quality of medical services that they can get here in the north. And since October 7th, we've actually accelerated some of the processes inside the hospital regarding services that were previously unavailable to the citizens of the North. Two of them are probably the main issues that are in the focus of the national healthcare system in Israel, which is physical rehabilitation and mental rehabilitation. Both of them are services that are lacking in the north of Israel, but luckily for us, we have begun planning them prior to the war and prior to October 7th. So nowadays, we are able to provide rehabilitation services in our newly opened Helmsley Rehabilitation Center, which was opened a couple of months ago, delivering all sorts of rehabilitation, from pediatric to soldiers, to adults, to geriatric rehabilitation, services that are lacking in the north. And when I'm talking about the north, some of them were not available until we opened them. The nearest services were located in Ra'anana, or in the center of Israel. So rehabilitation is one thing, and mental health, which is, I believe, even has an even higher demand in recent months and in the upcoming years, is something that we are already in the process of developing, and we're actually doing that also inside the rehabilitation center with a resilience center, and we are building a mental health center on campus, which will actually complete a 360 approach to the patient with general hospital, a rehab center, and a mental health facility, combining together a holistic approach to the patient and to the citizens of the North who deserve it.
It's a completely well-rounded approach to what kind of medical needs have arisen in times of the war, especially what you were saying about the mental health ward, which is so necessary. People don't really necessarily take into account how big the impact of trauma and mental health impact is on a war like this. And, the trauma from the situation in the north has got to be devastating for its residents. I want to mention, just on what you mentioned earlier, that some of the services until now, people from the north had to go all the way down to as far as Ra'anana. For those outside of the country who don't necessarily know, that means 3, even 4-hour drives sometimes for some levels of care. So kind of preventing that is truly incredible. How has the hospital addressed the issue of lack of resilience and devastation altogether in northern residents within, let's say, this mental health facility?
So, as you said, the issue of mental health and mental rehabilitation is probably the main issue that will stay with us in the following years, and this is why we have focused our efforts on accelerating the developing and building of the mental health facility. It's not only the job of a hospital, of course. The community has a major role in mental health and in resilience in general, and we're combining hands with the community and with the government, and together with other mental health facilities, we are planning and building the best possible solution for the citizens of the North. I believe that the main challenge yet to come is something that we actually saw and are still dealing with in terms of physical rehabilitation, is the manpower. We are lacking in Israel healthcare professionals, both in rehabilitation, both in mental health, and the shortage is nationwide, but it's much more intense in the northern periphery, and this is why we, as a medical center, joined hand with the Ministry of Health, and we actually promoted a joint venture whose main mission is to help healthcare professionals to relocate to the north of Israel as part of the rehabilitation of the north, and to come here and provide the services and the care that the citizens of the north deserve. It's a joint venture with philanthropy, with the Ministry of Health. It's called Talent Tech, and it actually provides, again, a round approach to those who seek and want to come to the north. We provide them with solutions for the spouses in terms of occupation, with professional advice. We provide them with housing solutions, of education for their children, and we promote positive immigration to the north of Israel of healthcare professionals to support those who will return, those who will join the new north the day after the war.
It feels like, alongside this entire situation. The hospital is sort of a lone medical hero standing firm in the northern part of Israel. What kind of challenges come alongside that?
I wouldn't say a lone hero because we are actually a part of a nationwide healthcare system, a strong healthcare system. But you can say that the distribution of resources is not equal, and the North deserves much a bigger part of the national resources. And it's not only governmental resources. I have to say that it is a challenge in the periphery to attract philanthropy, to attract those who usually go to the center of Israel, to the big medical centers in Israel, and provide them with the support that they need. We need this support in the north of Israel, especially in these times. And this is something that will help us to join hands with the community, with the fellow medical centers in the north, and to provide the services that the people of the north, not only in the east, also in the west, western part of the north of Israel, we all deserve a better access and better resources to the north. I mentioned it before. The health care and the strength of the healthcare system has to do a lot with those who will return and those who will want to relocate themselves to the north of Israel the day after and make the north not the way it was before, but a lot stronger, because this is what the north deserves. This is what the north needs.
Dr. Noam Yehudai from Tzafon Medical Center, Poriya, thank you so much for joining us today.
Thank you.